Understanding cataracts. A clouding of vision. Cataracts are a common eye condition. They affect millions of people worldwide. Cataracts occur when the natural lens of the eye becomes cloudy. This cloudiness interferes with light passing through the lens to the retina. The retina is the light-sensitive tissue at the back of the eye. The lens is made mostly of water and protein. The protein is arranged in a precise way to keep the lens clear and allow light to pass through. As we age, some of the protein may clump together. This clumping forms a cataract. Over time, cataracts can make it difficult to see. Cataracts develop gradually. They often affect both eyes, but they may not progress at the same rate. Early detection and treatment can help prevent vision loss from cataracts. There are several types of cataracts. The most common type is age-related cataracts. These cataracts develop as part of the natural aging process. Other types of cataracts include congenital cataracts, which are present at birth or develop during childhood. Secondary cataracts develop as a result of other medical conditions, such as diabetes or eye injury. And then there are traumatic cataracts, which develop after an eye injury. Symptoms of cataracts can vary depending on the type and severity of the cataract. Common symptoms include cloudy or blurry vision, double vision, halos around lights, difficulty seeing at night, faded colors, and sensitivity to light. An ophthalmologist can diagnose cataracts. An ophthalmologist is a medical doctor who specializes in eye care. During an eye exam, the ophthalmologist will review your medical history, test your vision, examine your eyes using a special microscope called a slit lamp, and perform other tests to assess your eye health. Treatment for cataracts typically involves surgery. Cataract surgery is a safe and effective procedure. During surgery, the cloudy lens is removed and replaced with a clear artificial lens called an intraocular lens, or IOL. Medicinal treatments, such as eye drops, cannot cure cataracts. These treatments may be used to manage symptoms and slow the progression of cataracts in the early stages. While there is no guaranteed way to prevent cataracts, a healthy lifestyle can promote overall eye health. This includes eating a balanced diet rich in fruits and vegetables, protecting your eyes from the sun with sunglasses and a hat, not smoking, and managing underlying medical conditions such as diabetes. Certain nutrients such as vitamin C and E and antioxidants may help protect the eyes from damage. Foods rich in these nutrients include leafy green vegetables, citrus fruits, berries, and nuts.